Okay, in this video I will be showing the process and procedure for hands-on CPR training. An AED, or automated external defibrillator, is a machine that analyzes the heart rhythm to people who are having cardiac arrest. The AED will deliver a shock on the needed person to help maintain a steady heartbeat. AEDs should be used when someone's heart suddenly stops beating. They can be used for adults as well as children. The first thing you want to do in performing CPR is call 911 or point to somebody and have somebody else call 911. This way they are on the way while you are giving the CPR procedure. You want to lay the person on their back like so and check their breathing for a minimum of 5 seconds. Check their chest for 5 seconds. If the patient is breathing, CPR will not be needed, but if the patient is not breathing, you will need to start chest compressions by removing the clothing first. To do chest compressions, you will place the heel of one hand on the patient's chest and the other hand on top, interlocking the fingers to keep them off the patient's ribs. You will start compressing on the patient's chest by using enough force to push down at least 2 inches. So you'll put one hand, the heel, in your other hand, and press down for at least 30. There should be about 100 compressions per minute, but after 30 compressions, you will want to open the airway by placing one hand on the patient's forehead, and tilting the head backwards, and the other hand on the chin to pull the tongue away from the back of their throat to give them an open airway, like so. You will start giving 2 full 1-second breaths. You will then want to continue 30 compressions and 2 breaths until an ambulance or AED arrives. And after, you'll do 30 compressions again. 2, 3, 4, 5, 6, 7, 8, 9, 10, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, and you'll want to continue that until an AED or ambulance arrives. Once the AED gets there, attach it to the patient immediately, and I will be using this as the AED. It's just like a breathing machine, but we're just gonna go with it. The AED should tell you exactly what to do, and make sure to follow all the directions that it says. You'll place the AED close to the patient's head and chest, like right there, and turn it on. Peel the back of the pads, and these will be the pads that I'm using. They're just like sticky pads. They have little things on the back of them. And you'll peel the back of the pads and place them on the bare chest where there's no clothing. You'll put one pad on the upper right chest, right there, and the other on the lower left chest, just below their nipple. So like right there. I don't know if you can see that, but like that. So they should be like diagonal from each other. Make sure the area is all clear, and then you will say all clear and push the shock button. So we're just gonna use this as a shock button. And after the patient is shocked, start chest compressions for 5 rounds of 30 again. So they're shocked. And you leave these on, you don't take the pads off, and then you continue. 1, 2, 6, 7, 8, 9, 10, 11, 15, 30. And you'll want to continue that for 5 rounds. After that, you will not want to take the pads off until AED or ambulance, well, AED is already here, but once ambulance arrives. And then once ambulance arrives, they will take control. And you might have saved somebody's life, so.